Congratulations, you've made it past 2021 and into the new year. Unfortunately, so did COVID. But here we are. We've learned to adapt and implement new measures to continue working safely. It's time to adapt once again now that there's new vaccines, variants, and other data available to us. On December 16th of 2021, OSHA Standards Board voted to readopt a revised version of the COVID-19 Emergency Temporary Standards, or ETS for short. This updated ETS will take effect January 14th, 2022, and will remain in effect until April 14th, 2022. OSHA has made changes to bring the ETS in line with the California Department of Public Health, or CDPH for short, recommendations. So, if you're an employer and are confused as to which recommendations or requirements you must follow, it is OSHA and the CDPH when referenced by OSHA. And just to clarify, we want to make sure you guys understand that OSHA has jurisdiction over the CDC when it comes to California employers. So, here's what employers need to know. 1. Employers still need to implement and maintain an effective written COVID-19 prevention program. It should cover how you identify exposures and the policies and procedures to correct unsafe conditions. COVID-19 safety training must also be provided to workers. So, connect with us if you need help offering this training. 2. Requirements regarding face coverings has been revised, including the definition of face covering itself. The updated standard adds a new requirement that face coverings must not let light through when held up to a light source, unless there are clear masks used for accommodation purposes. Requirements as to when face coverings are required will be consistent with the CDPH orders, so be sure to keep yourself updated with their recommendations. 3. OSHA made several changes to bring the ETS in line with CDPH testing and exclusion recommendations. This includes making COVID-19 testing available at no cost and during paid time to employees who were fully vaccinated, even if they're asymptomatic, after a close contact and during an outbreak. During outbreaks and major outbreaks, employers must now make weekly testing for outbreaks or twice weekly testing for major outbreaks available to asymptomatic, fully vaccinated employees in the exposed group. 4. Employees who have recently recovered from COVID-19 and those who are fully vaccinated are not required to be excluded from the workplace after a close contact, but must wear a face covering and maintain 6 feet of physical distancing for 14 calendar days following the last date of contact. 5. Employees that are not documented as fully vaccinated who had close contact but did not develop COVID-19 symptoms may return to work 14 days after their last known close contact, or may return early under the following conditions. A. 10 days after their last known close contact, the asymptomatic employee may return to work if they wear a face covering and maintain 6 feet of distance from others while at the workplace for 14 days. Or B. 7 days after their last known contact, the asymptomatic employee tests negative for COVID-19, at least 5 days after their last known close contact, and wears a face covering and maintains 6 feet of distance from others while at work. We'll be here to let you know if any more changes occur. Stay up to date by following us on all social media platforms and subscribing to our channel. If you need assistance with your COVID-19 training, writing your COVID-19 safety plan, or have more questions, be sure to connect with us below. Thank you.